Welcome, everyone. Thank you for joining us to learn about menopause. This presentation has been prepared and is presented by the Health Promotion Team at Women's Health Loddon Mallee and the Deaf Hub Bendigo, in partnership with the City of Greater Bendigo. The information presented here is factually correct and up to date at time of publication. Please regularly check recommended resources and references for any updates or changes. Women's Health Loddon Mallee acknowledges the traditional custodians of the lands on which we live, work, and play. We celebrate and respect the unique cultural and spiritual relationship that Aboriginal and Torres Strait Islander peoples share with the lands, sky, and waters, and the ongoing contribution their cultures make to the life of the region. As we pay our respects to elders past, present, and future, we pledge our commitment towards reconciliation and justice. We recognise the strength and resilience of all Aboriginal and Torres Strait Islander peoples and are dedicated to a future in which they feel connected, empowered, and safe within the communities of the Loddon Mallee region. Women's Health Loddon Mallee acknowledge the ongoing advocacy and resilience of LGBTIQ+ rights movements and stand with them in solidarity. Through our programs, policies, and practices, we are committed to addressing the structural and social barriers to health, well-being, and inclusion that LGBTIQ+ communities continue to face. We are guided collectively by the unique and different ways in which LGBTIQ+ communities experience gender and identity discrimination and continue to listen, reflect, and learn as we evolve our approach to ensure greater equity and inclusion across the Loddon Mallee region. My name is Catherine, and I'm a Health Promotion Officer at Women's Health Loddon Mallee. I work in the area of sexual and reproductive health and am passionate about equipping people with information that can keep them well, improve their quality of life, and navigate healthcare services. Beside me is Elise, our women's health nurse at Women's Health Loddon Mallee, who specialises in sexual and reproductive health. Elise is also a nurse counsellor at Breast Screen Victoria Bendigo. Elise has worked at both organisations for over 10 years, so many years' experience in women's health and cancer screening. Here's a photo of our office front in Myers Street, where our Well Women's Clinic and Pregnancy Choices Clinic are located. The purpose of this presentation is to share facts about menopause. We will cover what menopause is, when and why it happens, symptoms, treatment options, important stage of life health checks, and recommendations on where to access further information and advice. Menopause is a normal and healthy part of aging. It is described as the final menstrual period. More specifically, there needs to have been no period, that means no bleeding, spotting, or staining, for 12 months in a row. So, what happens at menopause? Let's start with the ovaries. Ovaries are where our eggs are stored in the female body. Ovaries also produce the majority of a hormone called estrogen, which is the main female hormone. Women are born with about 1 million eggs in each ovary. These decline over the years, and by menopause, there are no active eggs left. From about 35 to 40 years of age, your ovaries and hormones start to change. This means sometimes the hormones being released might be higher than normal, and at other times may be lower. This fluctuation in hormones can contribute to some of the symptoms we see at menopause and can affect our mental and emotional health. The reduction in our eggs and the hormone changes eventually cause you to stop ovulating, which means you stop releasing eggs from your ovaries. As a result, your monthly periods wind down, leading to menopause. For most women, menopause happens between 45 and 55 years of age, though the average age for women in Australia is 51 years. Some women will go through menopause later at up to 60 years of age, especially if there is a family history of late menopause. Menopause sometimes occurs earlier than expected because of cancer treatment, surgery, or unknown causes. Menopause is often spoken about in three stages: perimenopause, the menopause, and postmenopause. Symptoms may start to occur in the lead up to the final period during the perimenopause phase. Perimenopause usually begins when a woman is in their 40s and on average lasts 4 to 8 years, but can be as short as 1 year or as long as 10. Changes to your periods are often the first sign during perimenopause, but other symptoms may include hot flushes and mood swings. These symptoms may come in waves and are often worse before our period when estrogen levels drop. As estrogen levels shoot back up, you may have other symptoms such as swollen, tender breasts. Then there is menopause, the final menstrual period. You only know that you have had your final menstrual period if you've had no period, bleeding, spotting, or staining for 12 months. After the final menstrual period comes postmenopause. Estrogen, which again is the main female hormone, drops to its lowest around 2 to 4 years after your final period and stays low. Symptoms of menopause may continue for a few years into your 60s, 70s, and 80s. For how long will vary for each woman. As hormones change with the approach of menopause, you may begin to experience symptoms. They can be grouped into the two categories, physical and emotional, as they can impact both aspects of our health. On the screen are some of the most common symptoms. They are changes to your normal period. For example, they may be lighter, heavier, lesser, or more frequent than normal. Hot flushes, night sweats, problems sleeping, pain in your joints, and tiredness. Other common symptoms as seen on the screen may include anxiety or mood changes, dry vagina, overactive bladder or discomfort. Other symptoms can include sore breasts, redistribution of body fat, particularly around the stomach, bloating, crawling or itchy skin, headaches or migraines, difficulty concentrating, also described as brain fog, forgetfulness, and a lesser interest in intimacy. Not all women experience the same menopausal symptoms. 20% of women report no symptoms at all. Most women, or 60%, experience mild to moderate symptoms, and 20% report severe symptoms that significantly interfere with daily life. It is really important to discuss any new symptoms with your doctor or women's health nurse, as other conditions may have similar symptoms. Also, speak with your doctor or nurse if you don't have typical menopausal symptoms, are younger than 45 years and experiencing menopause type symptoms, or have other symptoms that don't fit the picture of menopause. So, what can you do about your symptoms? Treatments may help some symptoms, but the changes that menopause brings will still occur. Some things a woman can do to feel good through menopause and make symptoms easier to tolerate include taking care of general health through eating healthy foods and being physically active, being mindful through meditation and staying connected with friends and family are ways to look after your mental health, which is important during menopause as well. It may be helpful to let your friends or partner know what you're going through and how they can support you. Avoiding smoking and reducing alcohol intake are also important in maintaining good overall health. There are also medications available that may help you with your menopause symptoms, including mental health concerns. We will talk about these treatment options more next. As discussed, make sure you have regular checkups with your doctor as needed, making sure to let them know how you're going both physically and emotionally. For anyone experiencing bothersome symptoms, it's great to know that there is treatment available. The treatments available are often talked about under three groups. These are menopausal hormone therapy, non hormonal medical treatment, and natural therapies, also known as complementary therapies. Menopausal hormone therapy, also referred to as MHT or sometimes HRT, short for hormone replacement therapy. Menopausal hormone therapy assists with restoring hormones that naturally deplete during menopause. You should speak to your doctor about your options, your family history, and your own health history. There are many different therapies available. One may suit better than another. Also, just because a therapy is natural does not mean that there won't be side effects or that it won't interact with other medications you are taking. So it's important to discuss these natural options with your doctor as well. You can speak to your doctor or woman's health nurse about your treatment options. Seeing your GP for regular health checks is a great way of looking after yourself during and after menopause. The hormone changes that occur with menopause can impact other organs in your body, including our bladder, bowel, heart, and bones. Cervical, breast, and bowel cancer screening are also important health checks at this stage of life too. Regarding cervical health, it's important to know that bleeding 12 months after your final period is not normal and requires investigation. It's recommended to continue cervical screenings every 5 years from the age of 25 to 74. The self-collection option is also now available for all women. We go into further detail about this in our cervical screening video, which is also in partnership with the Deaf Hub Bendigo. The important thing to know about breast health is that at least 75% of all breast cancers occur in women over the age of 50 years. A breast screen, also known as a mammogram, is the best way to detect breast cancer in the 50 to 74 year age group. It can detect changes that are not yet visible to the human eye. Breast Screen Victoria provide free mammograms every 2 years from the age of 40 years onward. Regardless of if you have had a recent breast screen, any lumps or bumps should be reported to your doctor. It's a good idea to know what your breasts normally look and feel like so you know when changes occur. You can find out more about breast health by watching our breast health and screening video in partnership with the Deaf Hub Bendigo and Breast Screen Victoria. Cardiovascular disease is the leading cause of death in postmenopausal women, with changes in blood pressure and cholesterol potentially contributing to this. In relation to bladder and bowel health, incontinence, urinary tract infections, and constipation can be more common during and after menopause. Risk of bowel cancer increases with age also. You will receive a free fecal occult blood test in the mail through the Australian Bowel Cancer Screening Program if you were between the ages of 50 and 74 years. This test looks for blood in your bowel actions that may not be visible to the human eye. You can also get these from the pharmacy or request one from your doctor. Regarding bone health, the drop in estrogen after menopause can result in weaker bones that are at higher risk of fractures. Regular exercise and eating a healthy diet can improve our overall health, strengthen our bones, protect our heart, and help manage constipation. For more information or to organise your health checks, speak with your GP or another doctor who specialises in women's health or your women's health nurse. For further information on menopause, the Australasian Menopause Society and Jean Hales are fantastic online resources. That concludes our presentation on menopause. Thank you.